Hello, I'm Dr. Leigh Erin Connealy, and I'm the Medical Director at the Center for New Medicine in Irvine, California. The Center for New Medicine treats everything from cold to cancer, but we focus on integrative medicine, which is combining the best of conventional Western medicine or providing alternative treatments, which might be vitamins and minerals and herbs and acupuncture and homeopathy, IV treatments, and many more treatments. And today we have a special guest of a new treatment that we'll be offering at the Center for New Medicine. We have Philip Battiade from Germany, and he is a medical practitioner that treats all kinds of patients there too. And we're going to be talking about live cell therapy. You may or may not have heard about it, so stay tuned. So welcome, Dr. Battiade.
Thanks, it's nice to be here.
Yeah, so let's tell everyone out there listening what live cell therapy is. And people have also heard of stem cell therapy. So talk about live cell therapy and the difference between the two.
It's quite easy to confuse the two because they're very similar from the way they work. But stem cell therapy is really using human stem cells, which are either gained from embryos or gained from the person themselves, and these are injected, and they can turn into any kind of cell in the body to repair damaged cells. Whereas live cell therapy, we're actually using live cells from animal organs. And these cells are specific for the organ that we're using. So we use heart cells to treat heart conditions. We'll use liver cells to treat liver conditions.
All right. Now, is it the embryo part or the fully developed animal?
Yeah. Well, in the beginnings of live cell, they would use fully developed animals, and it's called some problems. So we use embryonic cells, so either from very, very young animals or from the embryo itself.
And what diseases would one treat themselves for live cell therapy?
Well, we can treat a whole range of diseases. Basically, any organ that needs help, you can help it to rejuvenate by using live cell therapy. Typically, live cell therapy is used for immune disorders. We're looking at patients with chronic fatigue or some brain neurological disorders, so with patients with Parkinson's or Huntington's disease, maybe just memory loss, things like this. And also we can use it to rejuvenate glands. So patients that are perhaps in menopause or patients that are older and need anti-aging, we can use the live cell on this as well.
Great. And what about anti-aging benefits?
They are incredible, let's put it that way. We see patients really benefit from an anti-aging program that we do with live cell therapy. So basically we inject cells from all different kinds of organs, and this helps really the organs to rejuvenate, and the glandular helps the glands to rejuvenate, so their hormone production is boosted.
Wonderful. Now what about, is there any side effects from this process?
Well, I'd like to say no, because basically there aren't any. I've never seen any. The main concern is, as with every kind of medicine that we take, or even sometimes of food that we eat, is an allergic reaction. So this might occur, and if you read in the internet, sometimes there are reports about this happening earlier. As I say, from our experience, this rarely ever happens. Our patients are screened very carefully beforehand, and we also do a skin patch test to make sure there's no reaction going on before we even treat a patient with live cell therapy.
Wonderful. So if we had a patient that came in today and we were going to treat them, tell me how they would experience it.
Okay. Well, it's a very simple procedure. First of all, we'll establish what organs they will need. So depending on what we're treating, we'll set up our protocol in that way. Then the patient has a blood test where we just do a simple blood count, seeing that everything's in order in that way, and we'll check the immune globulins just to see if they have a tendency to have an allergic reaction. After we've got the results of that, we do a skin patch test, so a little drop basically of the live cell solution that we're using is put on the patient's skin, and we'll see if there's a reaction to that. If there's no reaction, then the therapy lasts a minute, and it's simply just an injection into the muscle.
And how long would a typical treatment last?
Yeah, well, as I said, it depends on what we're treating, but typically we're looking at a 14-day regimen. Sometimes it's a little shorter than that, and this can be repeated once a year if needed.
All right. And what other really incredible things have you personally seen with live cell therapy in your clinical practice?
Well, we focus mainly on cancer patients and patients who are immune compromised in some way. So we've seen very good results, or very good improvement in the quality of life of cancer patients and their response to the therapies that they're doing. So many of our therapies are integrating this with their standard chemotherapy and radiation therapy, and this really boosts their immune system, so we see very positive results there. Also, patients who are immune compromised, so have perhaps chronic fatigue syndrome, by using thymus, for example, we can basically get rid of the symptoms they're having so they can lead a normal life again.
Well, this is wonderful because so many medical conditions today really we don't have answers for. And so this is just a wonderful new treatment that we'll be seeing lots more of and availability of in the United States. And so I'm just glad you were here today to elucidate all about life cell therapy.
Yeah,
so thank you for being here.
Thank you. It was nice to be here too.